Welcome back to Mayo Clinic Radio. I'm Dr. Jake Strand.
And I'm Tracy McCray.
Infections are a normal part of childhood. According to the American Academy of Pediatrics, most children will have 6 to 8 respiratory infections each year. These include colds, ear infections, sinus infections, bronchitis, and pneumonia. Infections that cause diarrhea and or vomiting are also very common, as any parent can tell you.
Some of the best kind of
Absolutely.
infections. When children are together in close quarters, such as a childcare setting or in school, infections are more easily spread from one child to another. So how can we help our kids avoid those nasty bugs that are going around? Here to discuss kids' infections and what to do about them is Mayo Clinic infectious disease specialist, Dr. Nipunie Rajapakse. Welcome back to the program, Dr. Rajapakse. It's great to have you here.
Great. Thanks for having me back.
So both Dr. Strand and I, kids in daycare. Mine are no longer in daycare.
Mine are
Yours
almost done.
In daycare. I think it's the best thing ever because they have gotten all of those bugs out of their system, and my kids have not been sick ever since they were in daycare. Am I imagining that, or is that for real?
So kids are exposed to a lot of different types of infections in daycare for sure. And by virtue of that, parents are often exposed to a lot of infections during that phase of life as well. So there are many infections. When you get infected with them once, you develop some level of immunity to them. And so it does kind of help to stimulate a child's immune system to be exposed to all those infections.
So I'm not imagining it.
Nope.
It doesn't make it less frustrating, though. I mean, I guess one of the things I'm curious about are what are the most common infections that kids are getting?
Sure. So there's things that circulate kind of during different times of year. By far, the most common infection would be the common cold, which we see kind of happen year-round. Common cold is caused by a variety of different viruses, actually over 100 different viruses, and that's why it is so common. As I mentioned, you can get some level of immunity to things you've been exposed to in the past, but when there's so many different viruses out there, there's a lot of different things that can circulate it in different places and over time.
What is the difference between a viral and a bacterial infection? Because the only reason it makes a difference, as far as I'm concerned as the parent, is do they get antibiotics or not?
Sure. So that's kind of one of the important distinguishing features. So viruses are tiny microscopic particles that we can't see. They can cause a whole variety of different types of infections. Some mild, like the common cold, but also more serious things like brain infections. As well. And so there's a large spectrum of diseases that we see caused by viruses. Bacteria are also microscopic, so you can't see them with the naked eye. And they too can cause a variety of infections ranging from harmless to quite serious and harmful, sometimes even leading to death. And so the main thing when it comes to treatment is whether or not they will respond to antibiotics. Viruses do not respond to antibiotics, only bacterial infections do. And as we're learning more and more about some of the harmful effects of antibiotics and running into more and more problems with antibiotic resistance, that differentiation becomes more and more important.
Do you think it's the case, because I hear this from fellow parents and family members, that it seems more and more we're hearing about the problems of overprescription of antibiotics. Is that because kids are generally getting more commonly viral infections? Would that be a fair statement, or is that overstating it?
So we do see a lot of antibiotic prescriptions being written for things that are viral infections and for which there are no benefits. It's one of the biggest kind of drivers of the overprescribing of antibiotics. It can be challenging in some situations when you have a patient in front of you to say for sure whether it's a virus or a bacteria. Kids are exposed to both frequently during childhood, but we really want to get away from using antibiotics in kids who have a viral syndrome or viral infection just because it's of no benefit to them and can cause harm.
Is that message more welcomed by parents now than it was when it first? Because when my kids were little is when, actually between my two children, is when all of a sudden we're not going to give out antibiotics anymore. The first kid got more antibiotic prescriptions than the second one did because the policies had changed. So are parents being not surprised by that, I guess, as much as they used to be?
Yeah, I think now parents have access to so much information. I think a lot of them are very aware about the issues of resistance and some of the impact of antibiotics on things like, for example, the microbiome. So we know that our body is made up of all sorts of good bacteria, and when you give someone antibiotics, along with wiping out harmful bacteria, you also wipe out some of the good bacteria. And so now I'm hearing a lot more from parents who are saying, oh, does my child really need an antibiotic for this, more so than in the past, coming in and sometimes asking or demanding from a doctor to have an antibiotic for their child. And so I think all this new information and knowledge that we're getting beginning, we're starting to kind of see the tides change a bit.
Well, and I think that leads to the next question. So if you don't get antibiotics, because a lot of these syndromes are potentially viral, what sort of things can you do to help kids get healthy, and how do you help keep them from spreading it to other kids?
Sure, that's a great question. Kids can feel very miserable when they have a viral infection. It's not like just because it's a virus, it's just a mild infection and they necessarily feel fine. But there are a lot of things that we can advise that can help them feel better. One of the things is using medications like acetaminophen or ibuprofen if they're having fever or feeling uncomfortable.
Wait a second. I thought that you're supposed to kind of let the fever be because it's there for a reason. And unless it's really high, you should just kind of let the fever be to burn away whatever it's there for.
Yes. So that's why I said if they're feeling uncomfortable. That was the key part of that sentence.
All right.
So you don't need to treat fever if the child is happy, playing, running around, looks perfectly fine. There's no reason to give them any specific medication for the fever itself. But if they're feeling kind of crummy or they're tired or not feeling well, they're not wanting to eat or drink, those are reasons why you might want to give them something so they feel a bit better.
But is it okay to leave that fever unchecked, to not treat it with medication if they are feeling okay? It's okay.
Yeah, so the most important thing when we hear about or see kids with fever, I think some people get quite fixated on the numbers of the fever and how high it is. But for us, really the most important thing is how the child looks. And so if they're running around, playing, eating and drinking fine, I'm less concerned about that child, even though they might have a really high number on the thermometer, as opposed to the child who might have a lower grade fever but is lethargic, sleepy, difficult to wake, not eating and drinking.
All right, so I interrupted you. So we've got the fever. What are some other things you can do to help them?
Sure. So aside from things like acetaminophen and ibuprofen, you can use warm drinks or cool drinks. A lot of kind of common cold or even influenza, things like that, are associated with some sore throat. And so in terms of also keeping them hydrated, those kinds of things can be helpful. Popsicles, another good thing. The most important thing when kids are sick is making sure that they stay hydrated. They may not want to eat much, which I think is fine for a few days until they recover, but getting as much fluids as you can into them as possible is super important. And so sometimes things like popsicles can both soothe the throat and also give extra fluids. The other big thing is kind of doing what you can to avoid transmissions. Obviously, in a household setting, especially if you have multiple kids at home, especially young kids, it can be hard. But making sure that everyone's washing their hands, practicing good cough etiquette. So by that, we mean coughing or sneezing into your elbow, disposing of tissues and things, washing your hands really well. As simple as it sounds is really the number one thing that we recommend.
So the funny thing is it hasn't changed much. I feel like I just read a Berenstain Bear book to my kids like a year ago, published in the 70s, about how Papa was doing a terrible job and not coughing into his arm, and it feels like we still keep telling people over and over again, but it's still really important. We still need to wash our hands and make sure that we're working on preventing transmission. That seems to be the huge issue that is over and over again and can't be emphasized enough.
Yeah, so I would say the kind of two biggest things. Wash your hands, wash your hands, wash your hands is huge. And then vaccines is the other big thing we can do to prevent some of these common infections in kids.
And finally, how long are kids contagious, or adults for that matter? How long should we stay home from work? How long should they stay out of school?
Yeah, so that's a complicated question. Depends a bit on what the actual infection is. For many common infections, the time that you transmit the most is usually the time that you have fever for. And so that's kind of a general rule is if you're having fever, you're probably shedding virus in your saliva and in your secretions and can transmit. But certain conditions like stomach flus can be transmitted for longer even after your symptoms, vomiting, diarrhea, have resolved. And so it's an important thing to talk to your doctor about when you see them so they can guide you a bit on when it may be safe to go back.
Well, thank you so much for being here. We've been talking about kids and infections with Mayo Clinic infectious disease specialist, Dr. Nipunie Rajapakse. Thanks so much for joining us, Dr. Rajapakse.
Great. Thanks for having me.